Welcome. You're listening to Ask the Doulas, a podcast where we talk to experts from all over the country about topics related to pregnancy, birth, postpartum, and early parenting. Let's chat.
Hello, this is Kristin Revere with Ask the Doulas, and I am thrilled to chat with Dr. Frances Conti-Ramsden today. She is so many things, but to me, she is one of the directors and creators of MEGI Health, and she is an obstetrics and gynecology registrar and a clinical academic who is passionate about transforming women's health through technology and innovation, combining her experience as an NHS clinician specializing in women's health with her current MRC-funded PhD fellowship. Fran bridges the gaps between clinical medicine, data science, and digital health. And she serves in advisory roles with femtech startups, helping develop AI-powered solutions for pregnancy care and personalized women's health. Her specialties include analyzing electronic health records and real-world data to drive clinical insights and enhance patient care. She is also focused on developing equitable healthcare solutions that work for diverse populations that have given Fran the opportunity to work on interdisciplinary projects at the intersection of healthcare and technology, leveraging artificial intelligence, natural language processing, and genomics to improve pregnancy outcomes. Welcome, Dr. Conti-Ramsden. It is a pleasure to have you on.
It's a real pleasure to be here.
And our topic is so important. We're going to be discussing blood pressure and heart health in pregnancy and how pregnancy is a stress test, an indicator of future health. So I am thrilled to chat about this and so many other topics.
Yeah, absolutely. So where would you like to start?
I would love to start with, that focus on blood pressure and the importance of heart health. And, you developed this high-risk certification program, which of course, preeclampsia would be one of those areas of concern with blood pressure, for example.
I guess I'm biased because I've worked in this space for quite a few years now. Blood pressure is tremendously important in pregnancy. And the reason why is both because it's a really common issue in pregnancy and because the outcomes can be, catastrophic for mum and baby. So we know that at least 10% of pregnancies will be complicated by some kind of blood pressure problem. And we know that the incidence is actually rising. So the number of pregnant women and individuals who are developing blood pressure problems has been going up. There's probably lots of reasons for that. So women are obviously becoming more economically empowered, more likely to have children later in life. Obesity rates are rising, and the rates of other medical issues in pregnancy, such as diabetes, is rising as well. The result that we see is things like chronic hypertension, so high blood pressure developing that already exists prior to pregnancy. And the rates of this complication have doubled in the last couple of decades. So we're seeing far more women with chronic hypertension, both in the UK and in the US. A recent study now of the US showed that over 15% of deliveries in the US were complicated by some form of pregnancy hypertension. So it's really, really common. The blood pressure problems in pregnancy, there's a real spectrum. So it ranges, like I said, from high blood pressure that is already pre-existing prior to pregnancy, but also new problems that arise. So some women will develop hypertension during pregnancy, and we tend to call this gestational hypertension or pregnancy-induced hypertension. And then, of course, there's preeclampsia. Yeah, so I'll pause there, and then maybe we can talk about what the sort of cardiovascular stress test side of things.
Yes, and I agree with you anecdotally as a doula, a non-medical professional. For over the last 12 years, I have seen an increase in concerns with blood pressure. And as you mentioned, hypertension, whether it's something that is developed during pregnancy or the pre-existing, as you mentioned, concerns that would put a client, in my case, or a patient in the high risk category, and certainly preeclampsia. I have seen more clients with preeclampsia more recently, like after COVID, than I had before.
That's really interesting. I mean, that's what the data is telling us. So these problems are becoming, more common. So I think as a doula, this is something that you're very likely to encounter. That's the reality. And I think that's been one of the reasons that we're focused. One of the approaches that we're taking, MEGI, is to really give doulas and birth workers, the training is open to anyone who's interested, to give them the knowledge and the confidence to understand, why do we care so much about blood pressure in pregnancy? What does it mean? What are the potential consequences? And what can you do as someone who is working alongside women, but outside of the medical space, both from the perspective of detection and helping support women in terms of managing this, but also because the other side, of course, is that these complications, like many complications in pregnancy, they can lead to really challenging situations for women and their families. So, for example, preterm birth, birth much earlier than expected. And then that has a huge repercussion for how a woman experiences her birth, her delivery, and, the early postnatal period. If you have a baby that's gone to NICU, if you've had a traumatic, very medicalized experience. And I don't know if that's something that you want to speak to, Kristin, from your perspective and your work.
Absolutely. And as you know, I have personal experience and passion in supporting high-risk clients. So I was very thrilled to be asked to contribute to the curriculum as an instructor for the MEGI program. I had preeclampsia, children later in life, and had what my nurse midwives deemed as a perfect pregnancy until I didn't at 37 weeks. And my blood pressure kept rising, was put on bed rest, and stopped working at that point. And then I was induced as my blood pressure kept rising and had protein in my urine, and they were concerned. So I was induced at 39 weeks and did end up with a NICU baby. I was fortunate in that I avoided many interventions, and so I did not have any pain management needs, narrowly avoided a cesarean birth. So I was fortunate in that my body took to the induction quickly, but it affected breastfeeding. It affected a lot of things, not only for myself, but also my baby. And then, so I have a lot of empathy for moms who are either, advanced maternal age or have risk factors. And I found that when creating Gold Coast Doulas almost 10 years ago, that the clients who had some complex medical issues or were, the twin and triplet moms were attracted to the care that my agency provided.
And I think this is exactly it. You have such a different experience of pregnancy, antenatal care when you're high risk, and I think a lot of the choice that women have is sometimes taken away from them. The recommendations for particular sort of interventions, sometimes, it comes down to even life and death. And I think doulas understanding that landscape of why do we do what we do in the medical sphere, and being able to effectively support women and helping them to continue to advocate, because there's often still some choices. And that's, one of the things that we go through in the courses, how do you support a more medicalized labor, but also being prepared for those outcomes like preterm birth, like unexpected NICU admissions, which can be so challenging. The areas that doulas can make this really phenomenal difference in women's experience, because unfortunately healthcare systems can be quite good at delivering the medical care, but in terms of that more sort of holistic support, and then particularly in the postpartum, it's bare bones, certainly in the UK. And I think I've heard very similar and actually often worse experiences in the US, that women are really on their own once the baby is born. And that can be a really, really challenging time.
Certainly, we work through the first year with day and overnight care into, as I mentioned earlier, a lot of twin and triplet work and work with NICU babies. And so there are complications that, in my opinion, are not addressed enough. So your program addressing things that can even happen post-birth and some complications to be aware of as doulas, including issues with blood pressure after delivery. It's not just in pregnancy or at delivery.
Absolutely. Absolutely. And that's actually, to be honest, that's a common misconception, even in doctors. We've been doing some focus groups. You hear some really heartbreaking stories. And so one woman was sharing that she had classic symptoms of preeclampsia, but she was postnatal, she'd given birth. And she was just told categorically by the doctors that postnatal preeclampsia doesn't exist. And that's just not true. So not only can you develop preeclampsia postnatally, actually, the majority of maternal strokes. So it's rare for a pregnant or postpartum woman to have a stroke, but obviously if it happens, it's catastrophic. The majority of those happen postpartum. They don't actually happen antenatally. So the postpartum is actually a higher risk period. So yeah, absolutely. We don't understand why, because preeclampsia is thought to be mediated by the placenta. So that's why we talk about delivering the placenta, i.e. ending the pregnancy, delivering the baby as being the treatment, because it's thought to be a placentally mediated, a disease that starts in the placenta, that's the cause. But that not, even though that's what we understand, it's absolutely possible to develop preeclampsia postnatally. And some women will also just develop high blood pressure, hypertension postnatally. That's also really common because you've absorbed a lot of fluid during your pregnancy, and all of that starts to move around postnatally. So, if you look at patterns, everyone's blood pressure tends to go up a little bit. But so if you are close to that borderline, you can often get pushed into an abnormal range. And one thing that's become so clear from the research is that high blood pressure in pregnancy and postpartum is dangerous, and we should treat it. So something that I think has been on obstetricians' minds for a long time, and there's been a maybe historic tendency to maybe undertreat women in pregnancy, is because we were worried that if we treated the blood pressure in pregnancy, we would reduce the blood supply to the baby through the placenta. So there's always been this, if you look at how we manage high blood pressure out of pregnancy, they're much more strict. They treat it more aggressively, whereas in pregnancy, actually, it's been a bit more of a gray zone, and people tolerate higher blood pressures. But what's really positive in the last 5 years is we've got 5 to 10 years, we've got really strong data now from high quality trials to show that treating blood pressure, getting it to a safe level, is absolutely the right thing to do. So it doesn't affect the growth of the baby. It's absolutely safe. And it's a message we really want to get out there, particularly, unfortunately, with lots of scaremongering, as always, for pregnant women around, are drugs safe or not? And that, these drugs are safe. They've been used for many, many years. And it's really important for blood pressure to be treated.
Absolutely. And I personally feel that, at least in the US, that 6-week appointment is much too far away. So it's nice that even as birth doulas, we meet with our clients within 2 weeks of delivery. So if we're noticing things that are abnormal in that healing phase, then we will certainly encourage them to reach out to their provider. But as you mentioned, just being aware and understanding how to advocate for yourself. And whenever I guest on a podcast, I always give the advice of, knowing your body and your baby and speaking up if something is wrong, because I feel like in our culture, women are just told to be strong, don't complain, be the perfect mom and focus on baby. But our own health is important, because we certainly can't care for our children if we're having issues with blood pressure. And so many, women have issues hemorrhaging after birth or retained placenta. There's so many other factors that we don't just need to tough it up. And it's important for partners to also be aware. And so partner education, and then having other professionals surrounding you, like postpartum doulas or birth doula.
Hey, Alyssa here. I'm just popping in to tell you about our course called Becoming. Becoming a Mother is your guide to a confident pregnancy and birth, all in a convenient 6-week online program. From birth plans to sleep training and everything in between, you'll gain the confidence and skills you need for a smooth transition to motherhood. Live coaching calls with me and Kristin, tons of expert videos including chiropractic care, pelvic floor physical therapy, mental health experts, breastfeeding, and so much more. You'll also get a private Facebook community with other mothers going through this at the same time as you, to offer support and encouragement when you need it most. If you'd like to learn more about the course, you can email us at info@goldcoastdoulas.com or check it out at thebecomingcourse.com. We would love to see you there. We also have a book called Supported, Your Guide to Birth and Baby, which makes a beautiful companion to this course. It's a great book for any expecting mother and is the perfect baby shower gift. You can find information on that book at supportedbook.com.
Absolutely. And I think the more that all the pieces of the team that a woman and everyone that a woman interacts with sort of in her journey are aware of these things, so that, they're like, oh, you know what, I've just had a really bad headache the last few days. Or, sometimes I think women are so busy, they may not even realize because they've got so little time for themselves, but maybe a family member's like, gosh, she's really swollen,
Right.
like that's really changed. And that's, that's important. So these are all things. So the classic symptoms of preeclampsia, headache, changes to your vision, swelling, particularly of your hands, feet, and face. These are things that the more that, as you say, both the pregnant woman and the people around her know about this and understand this is not normal. It might be normal, but it needs to be checked out. That's what's really, really important, is that people have that awareness that this is not something they should sit at home. The same as reduced fetal movements. You can say, oh, maybe I'll wait till tomorrow. We want women to come and seek that care, and it's not wasting someone's time. I say this all the time in clinic is, please come in. If you're worried, please come in, because you don't want to be that one that stays at home. And then there can be really, really bad outcomes for mum and for baby. And this is where the AI piece is interesting, because one of the things that I'm really interested in is, can we use AI technology to get this education, this information, this support to a wider audience? And it's one of the beauties of, generative AI and large language models, that you can have these conversations on a person's wavelength. So you can have the education there, so the model knows what it needs to say, and that's been very carefully kind of put together by clinical experts. But then you can then the AI technology can then be used for a woman to ask questions, so that she's really outside of her clinic appointment, she can get that information that she needs. And if she's worried about something, I think there's potential here. I still haven't seen a good example where we can replace humans, but certainly sort of augmenting and making sure that we're getting good evidence-based information to women. I think the potential for digital health and AI here is really exciting.
I'm a fan, because I feel like a lot of women will turn to some of those pregnancy and early parenthood boards, or like Facebook moms groups, and they're getting misinformation. And some of the comments I see in those groups are leading women in the wrong direction. So if they're getting evidence-based information from AI in order to better understand when to call their provider, so they're not, again, getting personal anecdotal information from other moms.
Yeah, exactly. And I think making that, what AI can do so well is making it, hopefully a bit more fun, a bit more accessible. So it's not just sort of dry, static content. And there's a lot of work to make sure that the right guardrails are in place, that it's safe, that it's not giving medical advice. There's a huge amount of work to be done. But nonetheless, I think this isn't very far away, because what we live now in the era of information overload. And it's really about trying to work out how to get good information to the right person, right time, right place. I think that's one of the challenges that we face. I just wanted to come back to this idea around sort of the wider picture around heart health and pregnancy. And this is something else that we talk about in the doula course, is sort of pregnancy as this stress test. And the reason being is that, I'm sure you know this both from your professional and your personal experience, is pregnancy is a huge ask on your body, right? So, everything is changing. So your heart, for example, and I always remember there was this a friend of mine who was male, and he said, oh, it really annoys me when pregnant women, they're not even showing, and they've got that pregnancy baby bump thing on. It's like they're not even really pregnant yet. And I was like, just so you know, a woman's cardiovascular system is changing completely in the first 12 weeks of a pregnancy. So she's actually most likely to faint in those early weeks when her heart is beating harder. She's vasodilating everywhere. So she's retaining more water. Everything is changing. And I remember his face being like, yeah, no, I didn't really understand about this. There's so much change that happens early on to meet the demands of a pregnancy. And what this means is that it's a bit like running a marathon, and a marathon that gets tougher and tougher towards the end. If you imagine someone running, if there's bits of you that are a little bit, maybe you weren't quite ready, or, you know, they're not coping well with the stress, by halfway through the marathon, you're going to be struggling if you've got that dodgy knee or shoulder problem. And pregnancy is the same. So if you have an underlying predisposition to a problem, pregnancy often, and this is what we really understand now. So for example, women who develop gestational diabetes, 1 in 3 of them will actually be diabetic or pre-diabetic at the end of pregnancy. And the risk of type 2 diabetes in the coming 5 to 10 years is really high, like over 70%. Similarly, women who have developed blood pressure problems in pregnancy, they have more than 4 times the risk of developing chronic hypertension, so lifelong hypertension, and more than around twice the risk of heart attacks, strokes, cardiovascular disease. So the other thing that we get all this information sort of about your health as a bigger picture of your health during pregnancy. And at the moment, we don't have the resources in our traditional healthcare systems to do something about this. So, you know, you have your baby, if you're lucky, you might get told about this and say, watch your weight or think about what you're eating, but there's no real support for women, and there's no opportunities to make that difference that might lead to a different outcome in a next pregnancy and lifelong health. And again, this is an area that I wonder, how can we use technology to improve this for women so that they can take the information they get from their pregnancy and make choices that's going to really hopefully improve their lifelong health.
Right. Yes, I am all for utilizing technology, but I also love involving women in their own care. I'm a huge fan of the Centering for Pregnancy model, where women are, you know, getting blood pressure cuffs and monitoring their own health in groups, learning about their body and baby, and having that communal weekly meetups or monthly, depending on the stage of pregnancy. And so, yeah, getting access to things like, again, blood pressure cuffs. So if they are in a maternal care desert in Michigan, where I live, we have some areas in the Upper Peninsula where they travel hours to a hospital. And so to be able to have access to some tools. So what are your thoughts on that?
Yeah, this is such a huge problem that we've been hearing about as we've been having conversations in the US, is actually, where can women get care? Because as you say, so many women are hours away from an OBGYN, and some areas, you know, we've been hearing in conversations with different groups, so both from women doulas and also providers, say, you know, yeah, we don't have them. And that's a challenge on a completely different level, because even if you can detect the problem, can you do something? You know, like, what can you do about it? And I think this is a really big issue. We need to think really carefully about how can we actually make an impact. One thing is around detection. So I completely agree with you, women being able to self-monitor, understanding the readings, and as you say, understanding their body, understanding what is potentially, you know, they need to seek medical attention. But we then also need to go that step further and say, okay, but, you know, if this woman has got hypertension, but the hospital is however many hours away, then what could a solution look like? And I think there's lots of groups doing really interesting work in this space, thinking about sort of community models of care, thinking about, does it have to be an OBGYN? You know, how would this look? And strangely enough, it's not so different from really, low and middle income settings, where there's often very limited resources and sort of skilled healthcare professionals. And that's where solutions like remote monitoring, digital health technology, and also point of care testing, so tests that you can do in the community and that can help you rule out or rule in problems. So what you want to be able to do is to send the women who are at high risk and who need urgent medical care. They're the ones that you need to say, okay, you know, you have to make the journey, but you don't want to send everyone on that pathway, right? So yeah, I think there's a lot of work that we need to do here to make safe models of care. But until we have that, the reality is, a woman with high blood pressure in pregnancy, particularly if it's new high blood pressure, she needs to be assessed. Like, there's nothing that someone can do in the community to say she's safe, because Preeclampsia sometimes has protein in the urine, but not always. You make the diagnosis on a whole different range of factors. So at the moment, there aren't tests that you can do in a community setting that would make you confident to say, yeah, this woman is fine. She can just stay at home for a few more days. High blood pressure always needs treatment. And if it's over 160, 100, that's like urgent, within like 4 hours. And you need to have an assessment to know, is this preeclampsia or something else?
Exactly. Great reminders. So let's dive into the MEGI High Risk Doula Certification Program for our listeners who may already be doulas and are interested in exploring that option, or our listeners who are interested in potentially becoming a doula in the future.
Absolutely. So this came out from us having conversations with doulas and working particularly with Damiana, who I know you know, Kristin.
Yes.
And trying to create something that would help doulas, as we said, support a high-risk client and thinking about the whole pregnancy journey. So it's a 6-week program. We've just finished cohort 1 and we're about to launch cohort 2, which is really exciting. And it kind of follows a journey. So it starts with sort of an overview. Week 1, we think about what does high risk mean, sort of the changing landscape of who is pregnant and giving birth in sort of our modern world. And then we go through sort of early pregnancy, sort of how pregnancy progresses and then complications, thinking about delivery, and then thinking about complex delivery and thinking about postnatal support when a baby goes to NICU, and then through to sort of longer postpartum recovery and future health planning. So things like contraception, family planning, and thinking about that future health piece. So you really follow the arc of someone's journey through pregnancy, and we sort of supplement that with 3 case studies that we follow their pregnancy journeys across the course. And obviously, it's the first time we've run it, and the feedback has been amazing. So, Kristin, I'd love to hear your thoughts, but I don't believe that anyone else is doing offering this kind of training in the same way to doulas. So I think it is quite unique in terms of being able to really focusing on that, the high risk, and thinking about what is a doula's role, and hopefully giving a lot of context and information so that doulas can come away a lot more confident. And I said the feedback we've had is really powerful for doulas to reflect on their practice and feel a lot more confident in supporting those clients, which has been great.
Absolutely. In my experience and opinion, there's nothing like the program, and even doulas who have multiple certifications like myself can benefit. And the up-to-date evidence-based information, and as you mentioned, just following client journeys and really being able to have real life examples to apply. And I think, with an agency like Gold Coast who specializes in more of that high risk clientele, that would be appealing for potential clients to see the kind of background and training their doula has, being so specialized, as again, it's all about continuing education and always learning as doulas, as society and things change. And as I mentioned, even anecdotally seeing an increase in issues with hypertension and preeclampsia in my career, and being able to adjust. And I love that you are also focused on that family planning issue, and beyond just supporting our clients in birth, but as a doula who's had some of the same clients for their 4th baby. So I followed them along many journeys.
Wow.
It is beautiful. And they always want up-to-date information, and they may have had, no health concerns earlier, and then all of a sudden are facing those. So to be able to adapt, and personally, I had preeclampsia with my first, and built a more extended birth and baby team to try to prevent preeclampsia with my second. And my kids are 21 months apart. So I did some family planning with my nurse midwives and OBs that I worked with in the good time to begin trying, but also knowing with advanced maternal age that if I wanted to expand my family, I needed to do it, in a reasonable amount of time. So I avoided preeclampsia, but a lot of it was focusing on diet and having a functional medicine doctor and all of these other members of my team, including birth doulas, to support that. And yeah, so having options and resources to be able to continue working with our clients is so important.
Yeah. Yeah, no, that's really interesting to hear. And I think, Damiana and myself, who co-created together, I think it's brought this really lovely marriage that, she's obviously a really experienced doula and understands what doulas do and the sort of the challenges. And my background is very much as a medical doctor and as an academic. And so we've sort of both together, we've managed to create something that both brings the kind of the science and the medicine, not about saying you need to be able to manage these patients. Of course not. It's not about that, but it's about understanding the significance, what these conditions mean, what do they look like, what do you need to look out for, and then thinking about that in the much wider context of a doula's roles. I think we've been able to merge those two worlds. And that's really what we're working on at MEGI, fundamentally, is thinking, how can we bring the things that we know work, so things like taking aspirin in early pregnancy if you're at risk, things like good blood pressure control, but how can you do that at scale? So how can you do that working with community partners? How can you do that working with thinking about technology solutions? So it's really about how can we get this information and the right support in place so that women can do get the best outcomes for their pregnancy and also their long-term heart health? Because one of the things that's really exciting to me as a researcher is that intervention in the early postpartum period may have really long-lasting health benefits. So there've been a few studies now showing that good blood pressure control in women who've had high blood pressure in pregnancy, in those early weeks postpartum, it leads to lasting benefits up to 2 years down the line. So 2 years down the line off medication, their blood pressures are better. And so, we potentially have this window of opportunity when a woman's system is changing, because as you know, there's huge amounts of change both when you fall pregnant and then in the postpartum period as you're readjusting to non-pregnancy. But of course, the early postpartum is chaos. How can we, this is the challenge, this is the grand challenge, is how can we develop solutions, tech, care pathways, which provider to actually enable women to get the best outcomes that we know medically and scientifically make sense. But that is so different from the reality of a woman's experience of the 6 weeks, of the early weeks postpartum, which are so tough for a whole host of other reasons. So how high up is the blood pressure going to be? And how can we develop solutions to really help women, achieve what I guess would be sort of medically and scientifically optimal?
Exactly. Well, I love it. How can our listeners reach out to you personally and find more information on the MEGI Health certification program?
Yeah, absolutely. So we have a website. If you search MEGI Doula online, it should come up as one of the first hits. So the website is www.megi.ai. And then we've got a whole section on the website for doulas. And so the MEGI High Risk Doula certification comes up there. You can also reach out directly to the MEGI team at hello@megi.ai. I'm on LinkedIn. So Dr. Fran Conti-Ramsden on LinkedIn, if you want to find me and message me there. So yeah, absolutely. Would love to get in touch with anyone that's interested in, working in this space, wants to find out more about the doula program. We'd love to hear from you.
Love it. Any final tips for our listeners, Dr. Conti-Ramsden?
So I've just actually submitted my PhD and I have my viva in 10 days. And I thought if I was going to summarize the last 4 years of work, I'd say it's all about blood pressure. It really is. So measure it, know what the numbers mean, and know when you need to seek help. And if you can help your clients with that, you will be essentially saving a life at some stage. It's so important.
Agreed. Thank you so much. And we'll have to have you on again. You have so much knowledge to share.
Thanks so much, Kristin. Bye.
Take good care. Bye.
Thanks for listening to Ask the Doulas. For more information about Gold Coast Doulas, visit us on our website, goldcoastdoulas.com. We're also on Instagram, Facebook, and YouTube. If you like this podcast, please subscribe and give us a 5-star review. Thank you. Remember, these moments are golden.